Hi, it's Dr. Wu, and I'm here today with Dr. Corola Cuenca from Santa Cruz, California. Dr. Cuenca is a naturopathic doctor, and also she's a specialist in computer regulation thermography. Now, we don't hear much about thermography in the United States, but when I was in Switzerland, when I was in Europe, everyone uses it. Why? Because it detects a symptom in a body way before it happens, like 6 months to a year. You can find out what's happening with your health. This is Dr. Corola Cuenca.
Hello, how are you? This is Corola Cuenca. I'm a naturopathic practitioner and homeopath.
Will you tell our audience a little bit about computer regulation thermography and why you do it and how long you've been doing it?
Computer regulation thermography is a German device, and it's been used in Europe over 30 years, and it was brought into this country about 15 years ago, and it's approved by the FDA for an adjunct to mammography. The reason I like it is because it's a device that is non-invasive, no radiation, and it's a good method to see what's happening with your organs, to assess what is functioning, over-functioning, or what is necessarily not functioning at all. And also it measures the breast without, again, the invasiveness of a mammogram. And it will detect things that are starting to come up to dysfunction in your body way before it's noticeable, even before you start feeling any symptoms.
Would you have a man ever test? Would you test a man too?
Yes, of course. Not only women are tested, and I even test children, but men also. And it's good because usually men don't go out to doctors as often as women, but they are also coming up now with a lot of men are also needing to do a test, and they come to me because they're concerned maybe of their prostate, or they're concerned about tiredness. So all these things I get to see before, sometimes even brain fogginess. So I get to see this and how I can help them.
How long does a test like this, how long does it take, and is it painful? What exactly, can you explain exactly, what do you do?
It's okay, the machine is a small device. It's about the size of a laptop, and there's a cable that comes out of it that has at the end a thermometer. It's a sensor, and what it does, it touches the surface of the skin, and 120 points are read. 10 minutes to read the 120 points, then 10 minutes to rest and adjust to the change of temperature when your clothes are off, and then you redo the test again. So the 10 minutes is to allow the body to adjust to that change of temperature, and then it will tell me how the organs and all the different systems in the body are adjusting and what their state of health is.
So my other question is, once you look at this and you see what the organs are doing and if they're healthy or not, what modalities do you use to treat the patient? You know, how can you balance them out? Let's say my liver's too fatty or too hot or too blocked or something, imbalanced somehow.
Okay, so since it does measure the endocrine system and the digestive system, it also will give me information of what would be the right one. If I can see in the gut if there is any mycosis, so I would address it with German homeopathic remedies, which are the best ones that I recommend because they're fast, effective, and gentle at the same time. So I would be able to.
Are they taken orally or?
Oh, they can be oral. They can be via suppositories, or there also could be injectables, which are all again natural and homeopathic. So there's nothing that would be they're drugless, in other words.
And what do you see after, let's say, a few months of treatment? Do you actually see a difference on the machine or no?
Oh yes. So then after, let's say, a 3-month treatment, that's only 90 days of being on the protocol that we put them on to correct whatever insufficiencies or hyperactivity. Then we do the test again. And once the test is done, then we can see how that organ was corrected. And then we see how the body now at this point doesn't need any more treatment.
So let's say you were going to test me, and I say, okay, I want to test, and I'm pretty healthy, I feel. So you do the test on me.
Yes.
And then what happens?
Okay. at that point, after I've done the test on you, I go over it because I print out the results and I go over the results with you at that point. I explain each one of the points I did and what I see would be the best treatment for you.
Will I understand the test, or?
Oh yes, it's the test is not an image. It's not a figure that you get out or a photograph. What you do is you get a result of a graph and bars and numbers. But all that I learned in Germany and in Switzerland. I trained with Dr. Rao, and they taught me in their clinic how to read this.
So once you've read it, and then you're going to say, Dr. Wu, you need to take
Yes.
this. You need to stop drinking coffee, or something.
Right.
Or
Well,
something I don't want to do.
Exactly. Let's say if there's something that you're being affected, maybe your liver is a little bit too, it's inflamed or it's stagnant. So we need to give you things that you would need to change your diet, or let's say eliminate certain things that are affecting that. Okay.
You talked a little bit about insomnia, and what I hear in the clinic is people say, I can't sleep, I have no sexual libido, I'm tired all the time. What else do I hear? I want to get pregnant. A lot of stuff around sex, energy, sleep, and being too fat.
Right. Okay. So all those points you just mentioned are all basically when a thyroid is under functioning. The weight, so the metabolism is low. So we need to probably the thyroid is under functioning, so it's hypothyroid. So what you do is you stimulate the thyroid with there's different products. I also use other German products from a company called Soluna, which will bring back health and balance to the thyroid. There's also other from the Sanum, from the German homeopathics. There's also one product that's called Attensin, which actually helps stimulate the thyroid. Now, if that will bring back some energy to you, it will also bring back some of the libido, because it will bring back a balance to your endocrine system.
Are these products safe?
They're non-invasive, again, non-drugs, and they will actually be safe, no side effects, because they're homeopathics.
Wow. Well, this sounds like a test that I'd really like to get, and I'd like to recommend to the people that I know, because it seems like it's going to give me a window into what could happen, and we can correct it before some bad things.
Yes.
Yes. Well, thank you today for coming to the clinic. Thanks for taking the time
You're
to
very
spend
welcome.
with me.
Thank you.
Okay?
Thank you.
All right.
I'll see you soon.
Bye-bye.
Bye.